Hi, this is Dr. Lorelei Walker. I'm with the Social Safety Initiative, and I'm the Director of Public Health Training. And I founded this nonprofit a year ago, and we are spreading the network of knowledge by helping take what's going on with the science and what's going on with public health recommendations and turn it into something that's what you need to know, or what to know, what to do, and how to do it, so that you can make your own risk assessment in the world around you and in the environment that you navigate in, because we each navigate in a different environment. If you've been following the last 3 videos, you'll see they've done back to back because the weed whacker person is still out here at my apartment complex, so that's just funny. In the first video, we talked about what to know. So what to know is how variants come around and how vaccines work and what to kind of expect in this situation with these variants and our vaccine technology, so that you can kind of keep track in real time, make more sense to interpret this. And we also talked about viral load, so what to know about the virus and how it spreads around you, and a little bit about how it works in your body. Now I want to move into what to know, what to do, then how to do it is the next set. Now we do have a guidebook on this that's 10 pages. It's available for, oh gosh, I think we have a donator who is able to subsidize it for like $50 right now on our website. But we can do bulk. It's in PDF, it's in English and Spanish, and it will go into this a little bit more. So, what to know, now we're at what to do. Well, what to do is look around for overlapping layers of risk. Now, we do this when we drive. When we drive, we're aware of the weather because that's going to inform how our vehicle responds. We're aware of if it's light or dark because that's going to inform how far out we can see what any threat is. That's going to inform also, or the weather rather, is going to inform us because that's going to inform if our braking speed is changed or if other drivers might be in pockets of water that we aren't, that will change. So how close do we need to get to them? How much control do they have? And I think that's very applicable when we think about overlapping risk for social hygiene, and in this case, for disease transmission, to apply social hygiene. So we know that spit, splatter, and spray is how the virus travels, and shared air that lingers around where people share air. And so social distancing is helpful because then our air is more likely to go up and out and the concentration way less and the virus dies in UV lights and filters and things like that. Or if it's not as much airflow inside, you've got a lot of people around. A lot of those people don't kind of stick together. They go out in society in other groups. And so that air gives the virus a way to hop around to a lot of people. And if there's a lot of particles hopping around, then you're breathing it in. And so your risk is higher. So you want to look for ways to mitigate that. We're going to talk about the protocols in another video. But that risk assessment, what does it look like? Well, I go into a grocery store and my child with me. It's a big grocery store. And so it's got big ventilation going. And that's good. It's cycling the air out. We want to get the air going about 4 to 5 times of fresh air exchange. Now, it will go ahead and take some of that air and put it through a good filter. Good filters are strong. It catches this virus and pollen and other viruses and bacteria and all this stuff that really comes out of our mouth. And it does it 4 to 5 times. It also brings the outdoor air in. So if you're around higher pollution areas or if you have wildfire smoke, you really need a big system to manage that. So when I go in, I notice kind of what the system is and how the air feels, feel cleansed and fresh. You don't want to smell like chemicals. That's not the same. and I look at how many people are going down the aisle. Now, grocery stores are probably okay. The grocery store is a problem more for the person working it. So if you're a worker, and a lot of us are, and you've got a lot of people coming through and you're talking to them, those barriers are nice because every once in a while you get the spit, splatter, and spray, but also their breathing air is more likely to shoot up into the ventilation system. And that's helpful because otherwise the breathing air is going back and forth. Now the person on the other side, they've only gotten a minute or two of it. You, unfortunately, or the person that you're is providing the service and working that day so that you can get those resources, that person's getting some of your air and the next air and the next air and the next air and the next air. So those masks are helpful. Those barriers are helpful because it not much makes it through and the ventilation system's more likely to capture it. If I go into a house of a friend I haven't seen in a while, and I have my kid with me because it's just harder to put the kids in different places these days. And I kind of assess in my mind, okay, who's in the room? Do they go out a lot? Do I know much about them? And, a lot of people talk vaccination status. There's a bracelet I saw Colin Mockery. I've met Colin Mockery as part of my family in a thing that we did a decade ago. He's a fun guy. And he was supporting online these bracelets you can get. And so it's just a quick indicator of whether or not you were able to get a vaccine. Some of us aren't able to get this vaccine because of some physical limitations. So that's a nice indicator. Or sometimes I'll wear my card. It's a little more, I'm a public health professional, so it's kind of more like a badge. But I always have my mask too, because it's for both of us. So in that situation though, masks, it's friends, everyone's been vaccinated, we've talked about that, we know about this variant, we're not really sure, but we really want to hang out. So that's when you make sure you got your air going. And if you've replaced your filter, we're going to talk about those protocols. But in those situations, see if you can move people outdoors to the porch, spread people out a little bit more, but look for those overlapping sections and where people congregate. Now, risk on surfaces, not so much. We have a cleaning guidebook. That's important because if you're over disinfecting, which you actually don't need to disinfect unless someone's sick. It's kind of the other stuff we worry about, like the poop and the blood and the urine. That's when you disinfect. Or if you're in an institution like a school, they have protocols. But in the indoor area, knowing when to sanitize which areas, you don't want to put too many chemicals into the air that now you've got everyone breathing these chemicals or that you're touching them a lot, because that causes other problems. Not just asthma, not just breathing problems, and not just triggering it. It also has some reproductive and hormonal problems in the long run. So we try not to use a lot of chemicals, and we try not to use them indoors. And we do use them, we use them safely. You can get our guidebook. So I think that's about overlapping risk. It's a little longer of a video, but this also helps with being in a car. It's hot, you need air conditioning. You want to get the air running. You've got someone next to you. It's kind of awkward to not talk. And also, you're just in a car. The more people you get in a car, the more people you have breathing. You really want to get that air moving and out as much as possible because you're doing a lot of breathing together. Kind of the same thing when you work out in a gym. You got your mask on, they've got good ventilation going, but you're doing a lot of heavy breathing back and forth. And so that could just be pumping viral particles out into the general circulation. The concentration goes up, like you saw in our last video. You're getting more breathe in, 15 minutes over the course of a 24-hour period. That's enough that then we have to see how much armor your body has in it. And you could be asymptomatic and spread to others. You could be asymptomatic, and we're starting to see where there's cases of people having some pretty significant kidney problems later on. They didn't even know they had COVID. They got the antibody test. They found out that they did have it. It was asymptomatic, or maybe even just a sniffle, and they got by and they were nervous, but it was okay. Then the kidneys are kind of like the canary in the coal mine. It means the virus did get in, just not in a way that was a fever that we could monitor it. So you really want to watch that oversharing of air. It's another symptom you can look out for, which, not to scare you, but it's called, I think, if I remember correctly from Dr. Ryan Walker, our director of microbiology and science education, it's like silent hypoxia. And what it is your body just stops carrying as much oxygen through it. You know how they put those little monitors on and it says like 97% concentration, 98, 100, you're good. How much oxygen your blood's carrying. Your oxygen goes down a little bit. It becomes a little harder to breathe, maybe a little harder to think, where did I put that? What was I doing? Not as sharp, but not alarmingly so. But you actually are suffocating is a hard word to use because it really is a triggering event. It makes us very scared, and it does because we don't want to suffocate, but we don't get that trigger that we might be suffocating slowly. And so that's what we want to monitor our oxygen levels. Go in if, it gets down, you might want to call your local doctor. And if your monitor level says, hey, I'm at like 92, 93%, what should I do? Or if you have a family member, make sure to call your local health department if you want to know what to do in the house. If a family member has now gone into the COVID ward and tested positive because they just were kind of having some trouble breathing. So that's a lot of information. But we'll keep breaking this down. In our next one, we'll talk about what to know, what to do. We'll talk about how to do it, the safety protocols. And we have a training corps now of public health professionals. They're cropping up from around the country, even around the world. They're getting this Train the Trainer training. And they're excited to come out and put out their own videos for their community members. They can come to your PTA meetings virtually and engage. We've got some opportunities to have people come out to speak to groups. If you're like a union and you have work site training going on, or you're a government organization and you've got frontline workers and they have team huddle meetings, we could do a Train the Trainer, train your supervisors, your HR staff, so that they have some training here and some safety stuff and ways for their workers to think about being safe. Contact us. We're at info@socialsafetyinitiative.org. We have a YouTube page with some of these videos. You can see more and learn about us. Our LinkedIn page is a good place to get updates on kind of what news to pay attention to if you're making decisions. And you can always reach me, LORELEI, at socialsafetyinitiative.org. But subscribe to our stuff and get on our calendar so that we can get the message out. Get the guidebook if you're an individual. We have a free one, guidebook to safe cleaning, sanitizing, and disinfecting in the era of COVID-19 and beyond. And make sure to watch our video on air purification because that is going to be a game changer going into the winter and for your family. All right, we're going to be okay together. Have a good day.